Laser tattoo removal. Have a tattoo you don't want, about to get it removed? It is always good to know the steps into getting a tattoo removed. It is estimated that close to 25% of the U.S. population has some sort of tattoo. Sooner or later, as many as 50% of them want to have their laser tattoo removed. There is good news for those who have an unwanted body design. Newer laser tattoo removal techniques can eliminate your tattoo with very little or even at all side effects. When getting your tattoo removed, the benefit of it is that you will not have the tattoo any longer if you take the right precautions to getting it removed. You can benefit from a laser tattoo removal. Because each tattoo is unique, removal techniques must be tailored to suit each individual case. In the past, tattoos could be removed by a wide variety of methods, but in many cases the scars were worse than the tattoo itself. This is why you need to find the right doctor to do this. Patients with previously treated tattoos may also be candidates for laser therapy. Tattoos that have not been totally removed by other treatments or through home remedies may respond well to laser therapy, providing the right treatments did not result in a lot of scarring. To find a very good doctor to do laser tattoo removal, you have to do your research. To have a tattoo removed, you want to make sure you find a reputable dermatologist or cosmetology surgery center to ensure proper treatment and care. If possible, you should obtain a recommendation from your family doctor for a dermatology or skin surgery center that specializes in tattoo removal. To search for these doctors, you can look in your local computers or laptop. Another successful search is also using Yellow Pages. This will have you view all of the best possible doctors available. And for the internet, you can use Google. Google is one of the best top searches in the world. There are certain things you can expect during laser tattoo removal. Depending on the size or color of the tattoo, the number of treatments will vary. Your tattoo may be removed in 2 or 4 visits, though it may take as many as 10 sessions. It also could take as many as 20 sessions, just depending on what kind of tattoo it is. You should schedule You should schedule a consultation during this time, and a trained professional will look at you, evaluate your personal situation, and advise you on the process of getting your tattoo removed. Treatment with the laser varies from patient to patient, depending on the age, the size, and the type of tattoo. Even if they are amateur or professional tattoo artists. The color of the patient's skin, as well as how big or tall or small the tattoo is to which the tattoo pigment extends, will also affect the removal technique in a bigger way. In general, this is what will happen during an office visit for a tattoo removal using the newer lasers. Protective eye shields are placed over the patient's eyes. The skin reaction to the laser is tested to find out the best working energy for the treatment. The treatment itself consists of placing a handpiece against the outside layer of the skin and activating the laser light. As many patients describe it, each pulse feels like a grease splatter or a snapping of a rubber band against the outer layer of the skin. Small tattoos require fewer pulses while bigger ones require more. In both cases, the tattoo requires several treatments and multiple visits. At each treatment, the tattoo should become lighter after time. Immediately following the treatment, an ice pack is applied to soothe the treatment area. The patient will then be asked to apply a topical antibiotic cream or ointment. A bandage or a patch will be used to protect the site, and it should really be covered with a sunblock when out in the sun. If you don't cover with the sunblock when out in the sun, it will burn and it will ruin and leave a scar. Tattoos these days are being very overrated. Taking these right precautions will allow you to have a successful tattoo removal without complications. Tattoos consist of thousands of particles of tattoo pigment suspended in the skin, while normal human growth and healing process will remove small foreign particles from the skin. Tattoo pigment particles are permanent because they are too big to be removed. Laser treatment causes tattoo pigment particles to heat up and fragment into smaller pieces, which sooner or later eliminates the tattoo. These small pieces are then removed by normal body processes. So remember, tattoos are not for everyone, because once it is on, it is on there 100%. So be smart about what you get as a tattoo, and also be smart about who you get as a doctor, and do the right research to get the tattoo removed by the right lasers. I am Jordan Coleman, and I am out.